The study of the upper limbs in anatomy involves understanding the structure, function, and relationships of the bones, muscles, joints, nerves, blood vessels, and other anatomical structures in the arms, forearms, wrists, and hands. Here is an overview of the main components of the upper limbs. Bones. 1. Shoulder girdle. The shoulder girdle consists of the clavicle, collarbone, and scapula, shoulder blade, which provide attachment points for the upper limb to the axial skeleton. 2. Arm. The arm consists of a single bone called the humerus, which extends from the shoulder to the elbow. 3. Forearm. The forearm contains two bones, the radius and ulna, which run parallel to each other. 3. The radius is located on the thumb side, while the ulna is on the little finger side. 4. Wrist. The wrist consists of 8 carpal bones arranged in 2 rows, the proximal row, scaphoid, lunate, triquetrum, and pisiform, and the distal row, trapezium, trapezoid, capitate, and hamate. 5. Hand. The hand comprises the metacarpal bones in the palm and the phalanges in the fingers. 5. There are 5 metacarpals, numbered from the thumb side, and each finger, except the thumb, has 3 phalanges, proximal, middle, and distal, while the thumb has 2 phalanges, proximal and distal. Muscles. There are numerous muscles in the upper limbs, responsible for various movements and actions. Some major muscles include: 1. Deltoid. Located at the shoulder, it forms the rounded contour of the shoulder and helps with arm abduction. 2. Biceps brachii. Located in the upper arm, it flexes the elbow joint and supinates the forearm. 3. Triceps brachii. Also located in the upper arm, it extends the elbow joint. 4. Flexor muscles. Muscles located on the anterior side of the forearm that flex the wrist and fingers. 5. Extensor muscles. Muscles located on the posterior side of the forearm that extend the wrist and fingers. Joints. 1. Shoulder joint, also known as the glenohumeral joint, it is a ball and socket joint that allows a wide range of motion. 2. Elbow joint, a hinge joint formed by the articulation of the humerus, radius, and ulna bones. 3. Radioulnar joints. There are 2 radioulnar joints, proximal and distal, allowing rotation of the forearm. 4. Wrist joint. The wrist joint, or radiocarpal joint, is a condyloid joint that allows flexion, extension, abduction, and adduction movements. 5. Carpometacarpal joints. The joints between the carpal bones and the metacarpal bones of the hand. Nerves. The upper limbs are innervated by various nerves, including the brachial plexus, which is formed by the spinal nerves C5T1 and gives rise to several major nerves like the median nerve, ulnar nerve, radial nerve, and musculocutaneous nerve. These nerves supply motor and sensory innervation to the muscles and skin of the upper limbs. Blood vessels. The arterial blood supply to the upper limbs comes from the subclavian artery, which becomes the axillary artery and then the brachial artery. The brachial artery further divides into the radial and ulnar arteries, which supply the forearm and hand. The venous return is through a network of superficial and deep veins, ultimately draining into the study of upper limbs in anatomy typically includes the bones, muscles, joints, nerves, and blood vessels of the arms, forearms, wrists, and hands. The upper limbs are composed of the humerus bone in the upper arm, the radius and ulna bones in the forearm, and the carpals, metacarpals, and phalanges in the wrist and hand. The muscles of the upper limbs are responsible for movement and are divided into several groups, including the shoulder girdle muscles, upper arm muscles, forearm muscles, and hand muscles. The joints of the upper limbs include the shoulder joint, elbow joint, wrist joint, and joints of the hand. The nerves that supply the upper limbs include the brachial plexus, which is a network of nerves that arises from the spinal cord in the neck region and gives rise to nerves that supply the muscles and skin of the upper limbs. The blood vessels of the upper limbs include the axillary artery, brachial artery, radial artery, and ulnar artery, which supply blood to the muscles and tissues of the upper limbs. Understanding the anatomy of the upper limbs is important for healthcare professionals such as physicians, physical therapists, and occupational therapists, as well as for athletes and anyone interested in maintaining optimal upper limb function. Deformities of the upper limbs refer to structural abnormalities or malformations that affect the arms, shoulders, elbows, forearms, wrists, or hands. These deformities can occur due to a variety of reasons, including genetic factors, developmental issues, traumatic injuries, or certain medical conditions. Here are some common deformities of the upper limbs. Club hand, also known as clubbed hand or radial club hand. It is a condition where the radius bone in the forearm is underdeveloped or missing, leading to a short or deformed forearm and wrist. The hand may appear deviated towards the thumb side. Polydactyly. This condition involves the presence of extra fingers or toes. In the case of the upper limbs, it results in the presence of more than the normal 5 digits on the hands. The extra digit can be fully formed or partially formed. Syndactyly. Syndactyly refers to the fusion or webbing of fingers or toes. In the upper limbs, it commonly involves the fusion of adjacent fingers, resulting in the digits being partially or completely joined together. Brachydactyly. Brachydactyly is a condition characterized by abnormally short fingers or toes. There are different types of brachydactyly, including type A, type B, and type C, each affecting specific bones or joints in the fingers. Madelung's deformity. This deformity occurs due to a growth disturbance in the distal radial physes, growth plate, leading to a deformity of the wrist. The affected wrist appears shortened, with the hand deviated towards the thumb side. Radial head dislocation. This condition involves the displacement or dislocation of the radius bone at the elbow joint. It can occur as a result of trauma or congenital abnormalities, causing limitations in forearm rotation and elbow movement. Amniotic band syndrome. A congenital condition where fibrous bands from the amniotic sac entangle the developing limbs. It can cause deformities such as constrictions, missing digits, or amputations in the upper limbs. Arthrogryposis. Arthrogryposis is a condition characterized by multiple joint contractures present at birth. It can affect the upper limbs, causing limited movement, joint stiffness, and abnormal positioning of the arms and hands. Radial longitudinal deficiency, also known as radial club hand or radial dysplasia. This condition involves the underdevelopment or absence of the radius bone in the forearm. It leads to a deviation of the hand towards the thumb side and limitations in forearm and wrist movements. It's important to note that the treatment options and prognosis for these deformities can vary depending on the specific condition, its severity, and the individual's overall health. Early diagnosis and appropriate medical interventions, such as orthopedic surgeries, physical therapy, or assistive devices, can often help manage or improve the functional abilities of individuals with upper limb deformities. Consulting with a healthcare professional or a specialist in orthopedics or pediatric orthopedics is crucial for proper evaluation and guidance.